Hello, my name is Gerald Espinoza, Clinical Specialist for Planmeca USA. Today's topic, scanning tip cleaning and infection control procedure. Enclosed in the box with your Emerald scanner, you will find the Planmeca Emerald Scanning Tip Infection Control Procedure. You may want to tape this up in the sterilization area. First, replace the scanning tip with the protective tip. Wipe the scanner with a disinfectant wipe. To learn more how to clean the boot, watch the Emerald boot cleaning video. With a soft toothbrush, rinse and brush the external surface under warm water for a minimum of 15 seconds. With a pinpoint brush, rinse and brush the edges around the mirror, making sure you focus on the crevices of the mirror for a minimum of 30 seconds under warm water. Avoid scratching the mirror, making sure only the bristles are in contact with the mirror. Rinse under warm water for another 15 seconds or until all visible debris is rinsed away. Assess the mirror. If any cracks or discoloration, the tip should be replaced. Individually place each scanning tip into an autoclavable pouch. Place on the autoclave tray in a single layer. Do not stack tips on or around other metal instruments. Select the wrapped or pouch cycle. The cycle should have a minimum temperature of 132 degrees Celsius or 269 degrees Fahrenheit. For pre-vac autoclaves, minimum time is 3 minutes. For gravity autoclaves, minimum time is 10 minutes. For any autoclave, use a minimum dry time of 10 minutes. Autoclave sterilization cycles exceeding 10 minutes could be considered excessive and may damage the tip. Please refer to the manufacturer's owner's manual for parameters of your specific autoclave and cycles. Refer back to the scanning tip infection control procedure for more detail. Please follow all warnings. This has been Gerald Espinoza. Thanks for watching Scanning Tip Cleaning and Infection Control Procedure.